Well, today is Daffodil Day, the annual fundraiser for the Irish Cancer Society. It's usually a very big success, but what exactly does the money achieve? Well, I'm going to be speaking about that with oncologist Janice Walshe in just a few moments. But first of all, our reporter, Aisling Riordan, has been looking at the cancer statistics here in Ireland. Aisling.
Thanks, Keeling. Yes, well, it's not surprising that the figures show that 1 in 3 people in Ireland will develop cancer during their lifetime, because we all know someone who has or has had the illness. Now, it's estimated that by 2020, 43,000 new cases per year will be diagnosed. That's going to be an increase of over 13,000, as the latest data from the National Cancer Registry shows that around 30,000 people were diagnosed in Ireland in 2011. Now, the 5 most common cancers in Ireland are non-melanoma, prostate, breast, bowel and lung cancer. And just to give you an idea of numbers, in 2009, over 8,000 people were diagnosed with non-melanoma skin cancer, while just under 2,000 people were diagnosed with lung cancer. When it comes to mortality, cancer accounts for over 1/4 of the annual death toll, with over 8,000 people dying from cancer in 2009. However, cancer is increasingly viewed as a condition from which people survive, with 42% of men and half of women currently surviving for 5 years and longer. And it's even higher when it comes to women with breast cancer at 80%. And finally, cancer prevention. Up to half of all cancers are preventable. 30% are preventable through lifestyle changes alone. And I leave you with this striking and frightening fact: smoking is the single biggest cause of cancer, causing nearly 1/3 of all cancers. Keeling.
Aisling, thank you very much indeed. Well, I'm joined now by oncologist Janice Walshe. Janice, thank you very much indeed for coming up from Vincent's this morning. One of the most striking figures actually in Aisling's statistics there was the increase in cancers going from 30,000 to 43,000. Why is that? Is there more cancer, or are you finding more of it?
I think there's 2 factors. The first is we're looking for it more. So one, I suppose, through many of our screening programmes, particularly in breast cancer, we have access to the national screening programme Breast Check. That has increased the number of cancers that we are finding, which is leading to better outcomes for those patients. We're now in the process of organising a national colon cancer screening programme, and if the results that we see internationally are replicated in Ireland, we'll see improvements in survivals in that regard, but we equally will see an increase in the number of colon cancers that we will diagnose. And I suppose through things like prostate and PSA screening, through blood tests, we are seeing increases in numbers. I think that's one issue, we're looking for it. And the second is that probably lifestyle factors are leading to an increase, a true increase in cancer numbers. And I suppose more worrying thing is increasing weight gain and the association with increased cancer risk.
So obesity is a cancer, because you'd think like people are smoking less, they're a little more conscious of exercise. You would think that actually lifestyle would be getting healthier rather than less healthy.
Well, I think we are definitely seeing with smoking related cancers reductions in some of those, but indeed, there's no question that obesity is a huge problem in Ireland at the moment, and as a result, we are definitely there's this consistent link with many cancers and weight gain.
Which ones in particular?
Particularly breast cancer, particularly in postmenopausal women, colon cancer, and of course, as you know, those account for the great number of cancers within our annual numbers. So.
Right. And Janice, can I ask you, it's Daffodil Day today all over the country. I'm sure people will be out collecting even with the weather, but what happens this money? Like, why is this money important? How does it translate to treatments is what I'm asking.
So
really.
I cannot overestimate the importance of that money and what it does. I suppose in terms of what has been achieved by money gained to date, the first is that there's been a huge campaign in terms of increasing cancer awareness, and as a result, patients are going to their doctor with symptoms far earlier than they would have done in the past. That's leading to earlier detection, and as a result, we know that many of these cancers will be operable, and then patients will essentially do better. That's the first. The second is that a huge amount of money is being invested in scientific research that will identify elements that we can then bring into clinical trial that can be investigated in
so new drugs, new treatments,
new tools to decide who needs treatment, who doesn't need treatment, which of course what we want to do is make sure that we're not over treating patients, that we are giving patients who truly need treatment appropriate treatment. And I think what's pertinent is this week we just hosted the European Conference on Personalised Medicine. We really want to move from this one-size-fits-all cancer approach and have more targeted therapy geared against those who truly need it.
That's really interesting. So stop the kind of the blunderbuss chemo approach and target it down.
Absolutely.
And Janice, can I ask you, I mean, OK, if you get one of the big four, the big five cancers, if you're going to get bowel cancer, breast cancer, whatever, there's plenty of treatments out there, plenty of research going on, plenty of fundraising for those cancers. What about people who get rarer cancers? What are their outcomes like?
Well, I think in the past there was no question that it was stagnant in terms of progress. Survival rates had not increased substantially, but there has been huge changes because I think particularly in areas in lung cancer that we traditionally associated with smoking, and it being the problem of the person who developed it, because if you stop smoking there wouldn't be a problem. I think what we're now seeing is increases in non-smoking lung cancers. There's been a huge amount of research in that regard. So I suppose what I'm trying to say is that with many of those rarer cancers in the past, they weren't truly the focus of novel approaches, but now they are. What is the difficulty with those is you're looking at smaller numbers, so it takes longer to accrue patients to clinical trials to get those answers. But we're also becoming cleverer in the way that we perform these clinical trials, identifying that a cancer is not a cancer is a cancer. There's all different things that we should specifically be looking at.
So you're really delving down into it. I mean, I suppose another problem there is if you're dealing with cancers that affect smaller numbers of people, they're not as attractive to drug companies to put the funding in because they're not going to make as much money out of any treatments.
And yeah, we have seen that definitely. But I think internationally, again, there's an understanding that within, you may, I suppose a lot of this would in the very rare subtypes be going on in the United States, where they'd have access to greater patient numbers and you would refer patients to sites from different states, and in that way achieving the results going forward. But it is hard for somewhere like Ireland, where in those rare subsets those number of patients will always be small.
It could be a handful.
Yeah, I mean, you could be saying in some cases 5, 10, 15 cancers per year. You're never going to have enough to perform a clinical trial in that cohort. But we look to our international colleagues to help us.
Great. Well, listen, Janice Walsh, thank you very much indeed for coming in this morning. Now, the Irish Cancer Society has said that its Daffodil Day goes ahead today despite the poor weather conditions. And if you have been affected by this item, the National Cancer Helpline free phone number is 1-800-200-700.